I wanted to take some time to talk to the family and friends of those of us who are going through cancer. Hi, everyone. As I just said, I want to talk to family and friends because I've been seeing a lot of posts lately on some of the help support sites that I'm on, where people are talking about how their family and friends just don't understand what's going on in their heads. They just don't understand why there are times that we're sad, times that we get angry, or they just don't care. They don't seem to want to ever talk about it, or they just feel, maybe they sometimes even make it seem like our cancer is an inconvenience to them. And so I wanted to talk to you about, at least for me, some of the things that I go through, and I'm sure that this will resonate with other cancer patients out there, especially those with an incurable cancer like mine, like LMS. So I want to begin with, first of all, that for many of us, we can't get away from this cancer, even in the times we're feeling good. And I will tell you that lately I've been feeling physically awesome. I'm not in treatment, and my last scan, although they found some things, it was still considered no evidence of disease. So, I should be absolutely happy and ready to go, but I'm going to tell you, I have times where I am not happy, where I am sad, even depressed, and it's one of the reasons is because I can't get away from this. I have reminders of it every single day. For example, when I get up to go take my shower, I see the surgical scars, and it's a reminder of what I've been through with 2 different surgeries. There are times that I'll just be feeling my chest and I feel the port that's still in me. And I'm reminded of the fact that even though I'm not in treatment, I have this port and they don't want to take it out because there's a high likelihood that I'm going to need it again. So I can't get away from this disease. I'm constantly reminded about it. We sometimes have friends or family that make comments to us that really are meant to help. And a good example of this is when I'm told, boy, you really look good. And I've gotten to the point where I'm okay with this comment. I'm glad that I look good now. But when I first started getting this comment, it was a really hard reminder of how bad I looked while I was in treatment. Again, a constant reminder of what it was that I've gone through. And even though the comment is obviously meant as a compliment and something good and something to make me feel good, which is what I do now when I hear it. When I first started getting that comment, it was kind of hard and actually a little bit depressing. So you need to be cognizant of comments like that what might seem like an innocent, positive thing could possibly be taken in a negative way. Another area is the fact that for most of us with LMS and many other cancers, we live life in several month chunks. And those chunks are the time between our scans, because we are constantly being scanned. And it starts out where for at least the first year or two, you're getting scanned every 3 months. So whether those scans come out clear or not, you still have another scan that comes up. And scanxiety is a real thing. I can't tell you how anxious I get the couple weeks leading up to a scan, because we're almost expecting that they're gonna find something new. It's hopeful that we're not, and I will tell you that when the scans do come back clear, we are thrilled and happy. But we also know we only have 2, 3, 4 months before those next scans. And so we try to live our lives in those chunks of time. And it's difficult, especially as we get closer to those scans. For me personally, the last 2 months have been quite anxious for me, because my last scans did show 13, I think, nodules in my lungs that are probably nothing. I'm hopeful that they will be gone on my next scan, which they possibly could be. But the thought is always going to be there. Could they be something more? Especially when you know that the lungs are one of the first places that metastasis happens. So yeah, scanxiety for me has been high for the past 2 months. I am getting scanned in 2 weeks, and we'll get results then, and I am hopeful that those nodules are gone. We are also tend to be hyper aware of our bodies. So things that we never would have even blinked an eye on when they occurred before our diagnosis, we now automatically go to a place of, could that be something? And examples are, I'll be just scratching my head and I'll feel a bump, and this bump has probably been there my entire life, but you kind of linger on it and you go, gee, is that something new? Could this be something? And it's just a thought. You might experience a pain in your stomach, and it might only last for a second, but you automatically go to the point of, oh my God, is this something developing here? And again, it goes to that point of where we never can get away from this, because there's that fear that it could be something. Making long-term plans for us is something that's difficult. It's difficult for me. Again, when you're living life in several month chunks between scans, it's hard to make long-term plans. For me, again, stage 4, high grade tumor. I've already had one reoccurrence. The chances of having another are pretty high. And so it's really difficult to try to make any kind of long-term plan, especially if those plans would require non-refundable tickets or reservations. And so I've been very leery about making any plans past my scans. I have gotten better. Tony and I have made plans for October to go to Zion National Park. I'm really looking forward to it. We're going to take a week and drive out there. But the only way I was able to make those plans is because they can be canceled without penalty. If there was any non-refundable ticketing or reservations that we had to do, I couldn't have made those plans. For fear that with the next scans I might be in treatment or might have to do surgery. So making long-term plans is difficult for us. So please understand, if your family member or your friends aren't making plans like they used to, this could be the reason why, that it's difficult for us to make long-term plans. One of the big ones for me is that I had to stop doing the one thing that I love, which is flying. I'm a private pilot that I just got my license a year before my diagnosis. So I haven't been able to fly as a pilot for over a year and a half. Now, because I've been clear and off treatment since March, I have been cleared by my doctor to be able to go and fly again. However, as I just mentioned, it's hard to make long-term plans. And flying, for me, for anybody, it's an expensive hobby. And I had canceled my flight insurance when I had my diagnosis, and I would need to start that up again in order for me to fly. So what I'm doing is I'm waiting for my next scans. If those scans come back clear, or if nothing's changed and we're still, not going to do anything, then I will get the insurance and I will go up and fly again. Yay for me. But if there is something there and we need to do treatment or whatever, surgery, then I still won't be able to fly. And so not being able to do the things that we love is really difficult and again, depressing at times. For me, having leiomyosarcoma and knowing that it's incurable causes great anxiety, and can for your loved ones too. I know it's not terminal, it's incurable. And terminal means, and there is a difference. There is a difference between terminal and incurable. I'm happy that it's just incurable, but that is something that we live with. And again, because it's incurable, there is a likelihood that it will come back at some point. Now, what's great is that there are people that have gone many, many years, 19, 20 years without a reoccurrence. And I'm hopeful that it's going to be that way for me too. But even those folks who have been going 19 or so years, I'm pretty sure that when they get scanned, they get scanxiety and they wonder if something is going to show up finally. So again, it kind of goes with that fear that it's always there, and sometimes you just can't get away from it as much as you try. Lastly, I want to talk about how we just want our lives back. We know that our lives have changed completely because of this diagnosis, and we want you, our family and friends, to really understand that our lives are changed. We don't want to wallow in it when we're sad. We don't want to be angry. We don't want to be depressed. All we want is our lives to be back. I would give anything to be going back to a crappy job that I hate if it meant that this cancer was gone. I just want to have my normal life back. I want the bucket list items that I had in place before to be able to still do them. I want to be able to fly. I want to be able to buy an airplane. And those are dreams that, at least the buying of an airplane part, is long gone. I can't do that anymore. And all I want is for my life to come back. And that's all we really want, is to have our lives back. You may have heard the term the new normal, and this is our new normal. I hate the term new normal. I don't want a new normal. I want my old normal back. And so do your friends and loved ones who are going through this too. For family and friends, please try to understand what it is that we go through. And try to show concern. You might not want to talk about it, but your loved one might. And we do need to talk about it. We're not necessarily looking for answers. We just want somebody to listen, and we want somebody to understand, so that when we do get angry, that you don't get angry back. You understand what it is that's making us angry. And that when we are sad, even though it's a beautiful sunny day and our scans are clear, that you understand why. And that you understand when we're hesitant about making plans 4 or 5 or 6 months out, that we might not want to do that or feel comfortable doing that. We don't want you to get upset that we can't do that. We want you to understand what it is that we're going through. I hope that this might have shed some light for you if you are a family member or friend. And if you're a cancer patient, feel free to share this video or take the content and use it to explain to your family and friends what it is you're going through. Most of all, I hope that my fellow cancer patients are doing well, that you are coping and surviving. But know that if you are depressed, if you are sad, if you're going through anger spells, that it is completely normal. And it's okay, but you're not alone. There's a lot of us out here. And thank God that there is, because it's only if you've had cancer that you can really understand what it is we go through. I wish you all well, and I hope you all have a great day. Thank you.